Hi, everyone. We're just going to wait a few more minutes just for a few more people to join us, and we'll start very soon. Happy Wednesday, everyone. On behalf of the entire Greenwich Medical Spa team, we hope you're all staying safe and healthy during this time. We hope that our Wednesday webinars provide something exciting and new to your day and help distract you with some positive educational information for exciting future procedures. We cannot wait to get back into the office and see your beautiful faces. Thank you so much for joining me today to talk about hair restoration and GMS's exclusive treatment called the Activator. Hopefully, I've had the opportunity to meet many of you already, but for those of you who don't know me, it's such a pleasure to meet you virtually now, but hopefully in person very soon. My name's Amanda Pucci, and I'm the clinical director and the aesthetic nurse practitioner at Greenwich Medical Spa. I grew up in Stamford, Connecticut, very close to our 3 offices, and currently reside here in Connecticut with my handsome French bulldog, Romeo, and my handsome boyfriend, Michael. I received my nursing degree from Villanova University, moved to New York City shortly after, and started working in the medical intensive care unit and the cardiac catheterization lab at NYU, where I worked for 8 years. While working full-time, I received my master's from NYU and became certified as an adult geriatric primary care nurse practitioner. My love for aesthetics came from my mom, Joanne, who has been a medical esthetician for over 25 years. And fun fact, she actually works at Greenwich Medical Spa with me as an esthetician. I've been a nurse practitioner at GMS for 5 years and absolutely love making people feel beautiful inside and out. And all my clients watching today, I miss you so much. I can't wait to get back in the office and see you all again very soon. So who is Greenwich Medical Spa? If you don't know already, we're an award-winning practice with over 15 years experience. We have 3 locations, Greenwich, Connecticut, Westport, Connecticut, and Scarsdale, New York, and plan on opening our 4th location in Ridgefield. We've been recognized as the top 100 provider of Botox and fillers in the nation out of 25,000 practices and have been recognized nationally as an expert injector site. We are a #1 provider of cool sculpting in Connecticut and Westchester County and number 25 in the nation. And I'm proud to represent Greenwich Medical Spa and beyond grateful to have been awarded by Real Self as being a top 25 most loved injector in the nation. So what do? We specialize in non-surgical procedures, anything that can make you look younger or better without surgery. From non-surgical wrinkle reductions to body contouring to hair restoration, which we're going to get into a little bit more in a few minutes, to acne treatments and even vaginal rejuvenation. We offer complimentary in-office consultations that provide our clients with detailed, customized treatment plans to create a very unique and individualized experience. These consultations allow you to get to know us and allow us to get to know you and your goals. We truly do aspire to create a partnership for the duration of your skincare journey, and it is our pleasure to guide you on that journey. So today I'm so excited to discuss GMS's exclusive hair restoration treatment called the Activator. I'll talk about what is known about hair thinning and loss, what current treatments are available to you, and specifically what GMS can do for you. We will discuss how the Activator treatment works, who's a good candidate, and what to expect from start to finish. I will also show you some of our amazing before and after photos, and I'll end the presentation with time to answer some of your questions. All right, let's dive in. So I'm sure each and every one of you listening knows someone, or maybe even that someone's you, who's experiencing thinning hair or hair loss. You are not alone. There's over 60 million men and women affected by hair loss. Since ladies are usually first, let's start this one with the men, and hopefully I have a few men out there listening today. But I love this slide because it shows the natural progression of hair loss in men through the ages. As you can see here, 40% of men will have noticeable hair loss by the age of 35. 65% of men will have noticeable hair loss by the age of 60. 70% of men will have noticeable hair loss by the age of 80. And 80% of men will have noticeable hair loss by the age of 85. What I would also like to bring your attention to in this slide is the pattern of hair loss in men. This pattern is actually called male pattern baldness. That generally begins with a receding hairline and progresses to the thinning of the crown. And you can kind of see that through here. So symptoms can vary from person to person depending on the cause of hair loss or thinning. However, as we talked about in the previous slide, many men experience the same general symptoms of male pattern baldness. This is the onset of hair thinning and loss at the hairline that progresses to the crown. As it progresses, you will end up with a horseshoe-shaped pattern that leaves the crown of the head exposed. And you can see that through here, this progression. And men are not the only ones affected by hair loss and thinning. Many of my female clients have asked me if this treatment is specifically for men, and I can confidently say that this treatment is beneficial for both men and female, and very effective for both, actually. Typically, to be completely honest with you, I would say our ratio of men to females is about 50-50 for the Activator treatment in our offices. As you can see in this slide, hair thinning and loss in women typically follows a different pattern, starting at the central part line and progressing laterally to the ears. About 12% of women will develop clinically detectable signs of hair loss by the age of 29, and 40% of women will have visible loss by the time they're 40 years old. Most commonly, women begin with that gradual thinning at the part line that you can see here in this picture, followed by diffuse hair loss radiating from the top of the head. A woman's hairline rarely recedes, and rarely do women become bald. So here are some fun, or maybe not so fun facts, but these are very real facts. According to the American Academy of Dermatology, the average number of hair follicles on the scalp is approximately 110,000, with the average number of hairs lost daily being approximately 100. In a recent survey of 800,000 sufferers seeking help for hair loss and thinning, 60% of them reported that they would rather have more hair than money or friends. In that same survey, 47% of hair loss sufferers would spend their life savings to regain a full head of hair. 30% of hair loss sufferers would even give up sex if it meant that they would get their hair back. So obviously what we're seeing here is that hair restoration and hair loss prevention is very, very important to both men and females. So what is actually happening to your hair? Time to get into the science behind what's actually happening here. So bear with me through the science. It's super interesting to understand how the hair is supposed to grow and how our treatments will help maintain this natural hair cycle. Naturally, our hair follicles go through a hair cycle that consists of 3 phases. Anagen, which is the growth phase, catagen, which is the transition or resting phase, and telogen, which is the shedding phase. Each hair is born in a hair bulb present with hair follicles. The anagen phase is where there's rapid cell division. The older dead cells are pushed out and the hair bulb, outside of the hair bulb, and then a baby hair starts to grow. This anagen phase lasts typically around 3 years, and on average, hair grows about a ½ inch a month. At any given time, about 85% of our hair follicles should be in the growth phase. The catagen is the regression or resting stage where the hair detaches from the blood supply and stops growing for about a month. At this stage, the hair follicle shrinks, but it doesn't fall out. So at any given time, usually about 1% of the hair is in the catagen phase. And the final phase is the telogen phase. This is the time where the mature hair falls off. This phase typically lasts around 3 months. Once the hair falls out, the hair follicles will re-enter the anagen growth phase and will repeat this cycle. About 10% of hairs are in the telogen phase at any given time. So during our lifetime, we have approximately 25 hair growth cycles. So it's important to note that the total number of hair usually remains constant in spite of our hair going through these different cycles, or these different phases that we just learned about. Ideally, 80% of the hair will be growing, while 20% of the hair will be resting or shedding at any given time. However, many reasons cause a break or change in this normal cycle. So why is this happening? Well, every day our world throws some not so nice stuff our way. To kind of jump into this for an example, with the recent COVID pandemic and what we're experiencing here, we get an increased level of stress, and stress being one of the contributing reasons as to why we lose hair. Additionally, we have allergens, hormone imbalances, genetics, poor nutrition, medication use, and overstyling, all being reasons that our hair thins and falls out. So this stuff accumulates in our body and interacts with our genetic makeup, and it sets off a series of responses that can disrupt that natural growth cycle, that can prevent the hair from entering the growth phase and push it to spend more time in the catagen or telogen phase. So let's dig a little deeper into how hormones can change our hair. Keep in mind, men experience these changes earlier in age with that strong genetic link, and women experience these hormone changes primarily with menopause and other conditions like thyroid issues or polycystic ovarian syndrome. The hair follicles themselves are sensitive to a hormone called DHT. This is dihydrotestosterone hormone in men, and then androgen hormones in women. When there's an increase in the presence of these hormones, there's a shortening of the growth phase, which is the anagen phase, and a lengthening of the resting and shedding, causing the hair follicle to shrink and shortening its lifespan. The hair follicle itself also changes, so it shrinks and produces a shorter, thinner hair shaft, and we go from having thicker, long-lived terminal hairs that are replaced with shorter and thinner hairs, and these thinner hairs are called vellus hairs. So I know we just went into a ton of details about the science and the hair cycle and what should be happening. But I don't want you to worry. There's a lot of good news ahead. Even though that hair follicle shrinks over time and results in a shorter, finer hair, the follicle itself actually remains alive. This means that the hair follicle itself is dormant, which I like to think of as sleeping and not dead forever, and can potentially be reactivated. That's why we named our treatment the Activator. So stay tuned for that. So what are your treatment options? In order to give you all the information and help you choose the right option for you, let's discuss treatments that are available currently for hair restoration that are both surgical and non-surgical. So the most popular surgical treatment option for hair loss is hair transplantation. There are multiple ways to perform hair transplantation surgery, including follicular unit strip surgery, which is abbreviated as FUS, and follicular unit extraction, which is also known as neograft, or FUE is the abbreviation. With FUS, the surgeon removes a 6 to 10 inch strip on the back of your head. He sets that strip aside and sews the scalp back together. The surgeon will then divide the strip into 500 to 2,000 tiny little grafts, each with an individual hair or just a few hair follicles, and then transplants these tiny grafts back into your scalp in your areas of hair loss. The number and type of graft you'll get depends on your hair type, quality, color, size, and the area that you're getting transplanted. And if you can see my pointer, that's this surgery here. With the FUE, or neograft procedure, the surgeon team will shave the back of your scalp, then remove the hair follicles one by one and replace those hair follicles back into the scalp in the areas of hair loss. The area heals with some small dots, and you can see that here in this picture. And the existing hair will end up covering that area that was shaved off over time. As expected with most surgical options, there is downtime and significant costs associated. The best results require repeated treatments, and the results take approximately 6 to 9 months. If surgery isn't an option for you, I am going to go into a good amount of detail on the non-surgical options that are available. Keep in mind, at GMS, we incorporate multiple non-surgical treatment modalities into our signature Activator treatment to give you the best possible outcomes. So non-surgical options, the first one I'm going to go into is low-level laser therapy, or abbreviated LLLT. Low-level laser therapy improves circulation and increases the energy to the scalp, which will basically increase the blood supply to the hair follicles. With regular use, usually about 3 to 5 times a week for 20 minutes a session, and a cost varying from $300 to $1,200 depending on which laser cap you use. You'll see an increased density and fullness, as well as have better product penetration to the scalp. We do incorporate this technology into our Activator treatment, so stay tuned on that. So platelet-rich plasma, or PRP, and platelet-rich fibrin matrix, PRFM, is an excellent non-surgical treatment option that we utilize in our Activator treatment. It's PRP, or PRFM therapy for hair loss, is a treatment that many hair transplantation surgeons are using prior to surgical intervention, but also in conjunction with surgery. It involves withdrawing a patient's own blood, spinning it in a centrifuge to isolate the plasma, which is the yellow component of the blood, which you can see right here in this test tube. And then once we separated the plasma, we withdraw it into tiny syringes and re-inject it into the scalp, into areas of hair loss and thinning. Your PRP and or PRFM contains your essential proteins and growth factors that will reactivate those stem cells around the hair follicles. And like I was saying, those stem cells that sit around the hair follicle are actually dormant or sleeping. So when we re-inject this product, your plasma, into your scalp, it will wake up these hair follicles to re-stimulate the growth phase, or the anagen phase, as we learned before. What I'd like to point out in this slide is that PRP and PRFM are not the same thing. PRFM can be thought of as the new and improved PRP, and that's because the newest studies that we have prove that PRFM allows these growth factors to stimulate those dormant stem cells for up to 7 days after injections. And so therefore there's an increased exposure to these proteins, and we have a greater chance of reactivating more of those stem cells around the hair follicle. So with the use of PRP technology alone, without the PRFM, it's usually a series of 6 treatments. And the reason I'm still telling you about this is there are, if you were to do some research, there are a lot of people who are still just using PRP alone. But the PRP is usually a 6 treatment protocol with 4 to 6 weeks apart, and a cost approximately around $800 to $1,500 per treatment. At Greenwich Medical Spa, we use the PRFM, the newest technology, and because the PRFM is so powerful, it's actually a 3 treatment protocol. Less injections and equal to greater results with that. And then before I leave this slide, I'd like to take this opportunity kind of to just tell you how impressive PRP or PRFM is, and how it's actually currently being used in experimental trials for COVID patients. So the same plasma that we're using to inject and reactivate these stem cells are being used to fight the virus right now. So basically, to fight a virus, the immune system develops antibodies, which are the proteins that bind to parts of the virus and impede the infection. And these proteins are rich and plentiful in our plasma. So in these cases, this antibody-rich plasma is being taken from somebody who's survived the infection and then infused into a COVID-positive patient to treat the infection, as well as to prevent future infections. So it's pretty cool stuff. Another non-surgical option that many of you may know is by its brand name is Rogaine. Is actually called minoxidil. Minoxidil is a topical solution for hair loss and thinning. This product works really well in conjunction with other therapies. When applied to the scalp daily, it'll prolong the growth phase of the hair follicle. Rogaine, which is the one that you guys would hear most of, is over the counter. It comes in a 2 to 5% concentration and is usually used twice a day. Prescription strength minoxidil is available. We have it here at GMS, and it's called Reactivate solution, and it's a 10% minoxidil and requires only a once-a-day application. Propecia or finasteride is an oral medication that is prescribed for men only. It does prevent the conversion of testosterone to DHT. And if you remember from our previous slides on hormones and how they affect your hair, that increased level of DHT will attack the hair follicle, stunt the growth, and is one of the major reasons for loss of hair in men. This is a great option for prevention and maintenance for the aging male. Hair supplements are another really great non-surgical option that may work to help thicken your hair. There are tons of hair supplements on the market today. The one that we actually use and we trust and highly recommend is called Nutrafol, because it's been very highly studied and has proven efficacy. Nutrafol is a highly purified, bio-optimized, and bioavailable botanical extract. It's clinically effective, it's natural, and 100% drug-free. By taking 4 capsules a day, it'll address most of the causes of hair loss that we discussed. It's got a multimodal biological activity with tons of super antioxidants and DHT targeting ingredients like saw palmetto, and they work against inflammation, DHT, stress, and environmental or oxidative damage. This product treats many of the factors that trigger hair loss and also helps reduce inflammation that are caused by these triggers. It improves hair growth, it strengthens and thickens the hair, and 75% of patients see a visible reduction in the shedding just after 2 months. All right, well, now that you have a very good understanding of what treatment options are available to you, both surgically and non-surgically, as well as understand what's happening with our hair as we age, let's get into our exclusive treatment at GMS. Drum roll, please. The Activator. The Activator provides a minimally invasive way to add volume and thickness back to your hair using a combination of many treatment modalities we've already discussed. If hair loss and thinning is a concern or problem of yours, I totally invite you into our office for a complimentary consultation. During this consultation, we'll go through a history of your hair loss and thinning, your medical history to rule out any additional causes, and we'll assess your hair to determine if you're a good candidate. At Greenwich Medical Spa, we feel that because there are so many causes for hair loss, and again, just to get into a few, the diet, stress, hormones, genetics, we feel that one specific treatment modality isn't going to fit everyone. This is why we created the Activator, which is a series of in-office treatments combined with at-home treatments, product use, and supplements. And this is because we want to maximize the chance of optimal results to give you thicker, fuller, stronger hair than just using one single modality. Specifically, the Activator is a combination of 3 in-office Platelet Rich Fibrin Matrix treatments, which are spaced out 6 weeks apart. The use of our at-home laser cap to further stimulate your hair growth. And there are many types of laser hair caps on the market, but the brand that we use is FDA approved for at-home use and has the maximum low-level light therapy of 272 diode. The third component of our Activator treatment is your at-home topical solution, which is AirRead MD's Reactivate, which is a prescription strength 10% minoxidil. And then the last component would be your hair supplements, which is the Nutrafol tabs that we talked about before. We believe here that incorporating all these treatment modalities to your non-surgical hair restoration plan will help you achieve faster and better results. Typically, our patients will see results as early as 4 weeks, with optimal results around 3 to 9 months. All right, we're going to just show a short video here to just kind of recap what we've learned so far, so bear with me. Sorry about that. Here we go. 80 million men living in the U.S. suffer from hair loss. The loss of hair control. Surgical solution that can slow or halt the loss of hair without surgery. We've developed an exclusive non-surgical hair restoration treatment called the Activator. The Activator has volume and thickness. It is a combination of in-office treatments coupled with prescription strength homecare products. Our in-office treatment is a series of PRFM injections into your scalp where the hair loss occurs. PRFM, also known as Rich Fibrin Matrix, are growth factors and proteins that are derived from your own blood, which helps stimulate your dormant hair follicles to regrow. Our Activator therapy continues at home with the use of our laser hair growth cap coupled with Nutrafol supplements and prescription strength topical hair products. We have found this combination treatment protocol yields better results than just in-office treatment alone. The Activator is performed in a series of 3 visits, spaced 6 weeks apart. Patients can start seeing results. At Greenwich Medical Spa, we use the Activator hair restoration treatment to help many men and women achieve thicker, denser hair while surgery. Okay, so getting into the details of the Activator and what to expect after you've received your complimentary consultation and you're ready for your treatment. So you'll come into your appointment with a clean scalp. Our amazing medical assistants will grab some pictures, and these will be your baseline photos for prior to the treatment. You will receive a consent form. The medical assistants will then draw 2 vials of your blood from your arm, and we'll place the blood into a centrifuge, which will spin for approximately 10 minutes. Once your blood is separated by the centrifuge, we'll draw up the PRFM and inject the plasma into your scalp, focusing on those areas of hair loss and thinning. There's mild discomfort from the pressure of the injections. However, the treatment is super quick. The entire injection process is usually around 5 minutes. And then with the second and third treatment of your series, they'll be about 6 weeks apart, and you can expect the exact same treatment process for the day. This treatment has no downtime. Mild redness at injection sites and tenderness usually resolves within 24 hours, but can last up to 72 hours. You can have a mild headache from the pressure of PRFM, which can last up to 72 hours after the treatment. However, most resolve in just a few hours. There's no scalp manipulation for 72 hours after your treatment, and this means no scrubbing or aggressive massaging of products into your hair. You can absolutely rinse the hair with water or brush your hair gently, but you just want to be mindful that the PRFM is stimulating those stem cells around the hair follicles for 7 days. So with the first 3 days being the highest concentration. So we really don't want to manipulate that process. Additionally, there'll be no alcohol-based hair products to the scalp for 24 hours. And since your first bottle of Reactivate topical solution is included in your treatment package, which just again to remind you is that 10% prescription minoxidil, I highly recommend using this product once a day. Usually nightly application is recommended, and you want to do this for the duration of your treatments. Best case scenario, I'd actually have you use it for up to 6 months after your treatment to really help increase that blood flow to the hair follicle. And help maintain that hair in that active growth phase. And then lastly, you'll receive your first bottle of Nutrafol as part of your package as well. And again, I would highly, highly recommend using this supplement for the duration of your treatments. And ideally, I'd have you consider using this supplement as part of your daily vitamin routine indefinitely. So results vary from person to person, with the optimal results typically presenting around 3 to 9 months. How early you see results and really depends on where your hair is in the natural growth cycle and what your cause of hair loss may be. But we have some people who can see results as early as 4 weeks. It just really depends. Follow-up photos will be taken 6 months after your last treatment, so we can compare your before and after pictures. And then additionally, this follow-up appointment allows us to develop your unique plan for maintaining the hair growth. It's usually recommended to perform maintenance treatments, which would just be one treatment of PRFM every 6 months to a year to preserve the results. And again, these plans, your maintenance plans, will vary depending on the severity of your hair loss. All right, my favorite part of the presentation is here. This is the part where we get to go into some of our before and afters from our patients in office. Keep in mind that results do vary, and that again has to do with the cause of the hair loss and how long the hair has been thinning out. So this is our first patient, a 42-year-old female with a complaint of hair thinning. Starting at her hairline and into the part. And as you can see, this is that typical female pattern of hair thinning that we talked about. She had the Activator treatments inclusive of the 3-treatment protocol, the laser cap, the Nutrafol tabs, and nightly minoxidil use. And she had a great result here. And you can see, the thinning all through here and the regrowth that she had through here. This is a 48-year-old male with the standard male pattern baldness. We discussed the history of his hair thinning and loss, and he stated that he's been gradually seeing his hair thinning since he turned 30. He's told us that his mom's dad went completely bald by the age of 55, but his dad and his dad's dad had only mild receding hairlines. He is on Propecia since he was 40 and thinks that it's helped slow down some of the thinning. We did do our activator treatment on him, and his results were incredible. He does maintenance treatments every 6 months and continues to use the Reactivate solution nightly, the Nutrafol tablets, and Propecia daily, and he tries to use the laser cap at least 3 times a week. This is a 53-year-old male who stated he started having a receding hairline since he was in his 20s. He's always kept his hair very short because it made him feel super insecure. He's played with using some over-the-counter Rogaine and inconsistently took biotin pills, but never really stuck with either because he never saw the results he was looking for. We did the activator treatment on him, and I got him to use the Nutrafol pills and Reactivate every day, and he was super happy with the regrowth that he got. He was able to grow his hair longer because he had more noticeable thickening, and we do maintenance treatments every 6 months, and he continues to feel more confident about his hair. This is a 45-year-old female with very, very thin hair. She came into the office stating her hair has always been thin, but with early onset menopause, she noticed increased thinning and loss of hair in the shower, and her part becoming more scant. She was a great candidate for the activator, and after 3 treatments and with all the other treatment modalities, she had impressive regrowth and thickening to her part, and she felt that she had more hair in her ponytails. And we continue to do treatments on her annually. This is a 50-year-old male who had complaint of thinning and balding to the crown. He said that it started really in his late 20s. And as you can see, the activator treatment really helped him to regrow his crown, but also notice the thickening of the hair. You can see, I'm just using my pointer here, you can see the thinning that he had here, but even out into the general, the thicker portion of his hair, it's definitely, you see more regrowth and thickening throughout. So this is a here we go. This was my next before and after that I was going to talk about. This is a 78-year-old female patient whose son-in-law actually came in and bought her the activator treatments because he said that she kept complaining about how her hair was thinning as she was getting older. She came in, never believed anything could work. She just thought that this was, you know, the natural part of aging, and she was incredibly grateful and returns annually for her maintenance treatments, but you can really see that regrowth and thickening all throughout here. So this is a 46-year-old male with the typical male pattern baldness, starting with the receding hairline and progressed to the thinning of the crown. This man uses Propecia daily, as well as the Nutrafol and the Reactivate solution. And after the 3 PRFM treatments, he's had great regrowth and thickening to the hair. This is a 38-year-old female who states that she hated the temple region of her hairline, which is right in here, and that it's progressively thinning after her pregnancies. She's a nurse and always wears her hair up and admits to wearing it pulled a little bit too tight. We discussed overstyling and hormone changes are both reasons that women generally can see some hair loss. And after doing the activator treatment on her, she had some really great regrowth in her temple region. This is a great before and after because it shows how results can vary. And what I'd like to draw your attention to in this slide is that despite receiving our activator treatment, it's not going to regrow an entire head of hair for all patients. This is a 61-year-old male who's had years and years of thinning and balding to his crown, most likely related to hormones and genetics. And he came into the office really just looking for some thickening and regrowth. As you can see, he's had some really nice hair regrowth, especially considering he's been getting bald for over 25 years. So he was super happy with this, and we continue to do maintenance treatments on him annually. And you can really see, if you take a look, even areas that have been bald for as long as this has been, you can have some nice regrowth. Here's another example of thinning to the crown, but in a younger patient. This is a male who's 35 years old and wanting to get ahead of his long line of balding in his family. We started him on Propecia and implemented our Activator treatment protocol, and he's had incredible results. This brings me to another point that I'd like to point out is the earlier you initiate these treatments, even if it's for preventative purposes, the easier it is for our plasma to activate those sleeping hair follicles because they haven't been sleeping for as long. So keep in mind, you don't have to have full-on balding or thinning to be a candidate for this treatment. You can do this treatment preventatively with really great results. Okay, at this time, I'd like to open the webinar to questions. Please feel free to ask me whatever questions you may have. I'm going to try my best to get to all of them before we end the session, but if I don't, please, I will get to them. Okay, the first question is, does it hurt? It has mild discomfort when we're doing the injections themselves, and the discomfort really comes from just the pressure of the PRFM being injected into the scalp. But the injection process is truly about 5 minutes long, and typically our patients, we don't use any numbing or anything like that, and people find it pretty easy to get through. The next question that I have here is, do you just inject where it's thinning? And if you just inject one area, does it spread to the rest of the hair follicles? That's a great question. So when we first assess and plan where we're doing the injections, we do focus those injections on the areas where those stem cells are not activated. So it could be where the, receding hairlines in those specific areas of loss and thinning. I have tons of patients that don't have distinct areas of thinning where we inject just all over the scalp to really just continue that growing process. It just really depends. We do individualized assessments and plan out exactly where we're going to be injecting the product. The next question I have here is, does one fee cover all visits, or is there a cost per visit? And is the cost the same for the maintenance visit? This is a great question. So we bundle our activator, since there's multiple treatment modalities, into one lump cost, which would include all 3 PRFM treatments, plus your first Nutrafol tablets, your first Reactivate solution, minoxidil, and your laser cap. And we bundle that whole price into one. Your maintenance treatments will be specifically just for the PRFM injections. And you usually have to do one every 6 months to a year. I have another question for the cost of the activator. So just to kind of go again into the fee that it is, we charge $3,500 for the entire package of the activator with all your treatment modalities, including the laser cap. And then your maintenance treatments would be would be $800 every time you come in for a maintenance treatment. The next question I have is, will hair extensions damage my hair? this is one of those over-styling reasons that we thin out our hair. It is pulling, when you get hair extensions, you pull on the hair follicles themselves. So it can damage your hair, yes. The next question I have here is, if I take medications chronically, which result in hair loss, will this treatment still work? Um, that's a really good question, and hard to answer without knowing exactly which medication you're currently taking. When you come in for your complimentary consultation, or given the times, if it's a virtual consultation and we're talking about this, I can assess whether or not that specific medication will affect the results of what the activator does. But depending which medication it is, it's hard to answer that directly. But we can talk more about this in detail on the side, as we can assess your medical history. The next question I have here is, can you go to work the next day? You absolutely can. There is no evidence of the treatment being done at all. Even as soon as you leave the office, no one would be able to tell that you had the treatment done. So you can absolutely go to work work the next day. I have a question here. Actually, this is a repeat question. Give me a second. I'm going to scroll down. I love that you guys are asking tons of questions here. I'm really hoping to get to all of them. Okay, my next question is, it seems like maintenance would be ongoing, question mark. Maintenance is required. So for whatever reason that those stem cells are being put to sleep or dormant, whether it's a medication, whether it's environmental or hormonal, whatever that reason may be, we do need to constantly maintain the regrowth process to wake up those stem cells. So it varies from person to person. Again, I have some people who come in every 6 months, some people who come in once a year, but it would be something that you need to maintain. I have another question here. Can I continue to dye my hair? Absolutely. You definitely can dye your hair. You wouldn't want to use any hair dyes within the first week after your treatments, as we're allowing that PRFM to really re-stimulate those stem cells around the hair follicle, but you can absolutely dye your hair. How long does your treatment take? The treatment itself, the whole process of coming in, taking your pictures, getting consent, and then spinning the blood, re-injecting into the scalp, usually I would say you're going to be there, I would plan for about 30 to 45 minutes in total. The treatment itself, the actual injection component, is really only going to take probably about 5 minutes. Can I do this treatment while breastfeeding? That's a great question. So there are no studies that are done on breastfeeding or pregnant patients in any aesthetic treatments. However, with breastfeeding, because the plasma stays local and it's your body, there's nothing added to your plasma. This is strictly your blood being re-injected back into areas of hair loss. And there's no lidocaine or any topical solutions like that being applied prior. You can do it while breastfeeding. Next question said, will this fully correct areas of balding? Like I was showing in that before and after with our male patient, depending on how long the area has been bald and how long these hair follicles have been inactive, it's harder to really wake them up. So We've had some incredible results from people who've been bald for a long time, and we really get to see those hair follicles starting to grow. But it is harder. The longer you've been bald, it is harder. And I would never say that this fully corrects. I actually would say that all treatments don't fully correct hair balding, even surgical options. But it's a really, really good option to help regrow a little bit of that hair. Next question I have here. How many days or weeks would you be able to color your hair prior to the treatment? Prior to the treatment, you can actually go ahead and color your hair. There's no issues whatsoever. You just don't want evidence of the hair dye on the scalp. So you'd really want to make sure that you've washed your hair prior to coming in. But there's no restrictions on how many days or weeks before you get your hair colored before the treatment. Next question here, since I'm in quarantine and cannot get these treatments done right now, what can I do for my hair? That's a great question. And there's a few questions actually here that are asking me, what do you recommend now that I'm in quarantine? So specifically to the Activator treatment, stay tuned because we do have on our website a package deal for the at-home hair treatments modalities that we talked about. So we are packaging a laser cap, the minoxidil solution, and your Nutrafol tabs that you can go ahead and get started on prior to your Activator treatments themselves, which have to be in office. So that's definitely an amazing way to get started while we're all at home. And then at the same time, we do have a Shopify account. If you go to gmsskinlab.com, we have a ton of options of skincare products, Nutrafol tabs, and I believe our Activator at-home treatment package will be added there. If you do not see it there, please call our office and we'll help you with that. It should be uploaded very soon, but we do have our online shopping cart that makes it super easy for things to be shipped right to your home from our office. Next question that I have here is, what's the cancellation policy if I suffer side effects before the end of my treatments? That's a really good question. There's really limited side effects with this treatment. However, we work with each of our patients, case to case basis. If you're suffering side effects and you don't want to go through with the rest of the treatments, we will absolutely be working with you. But I would want to reassure you that these treatments are fairly safe and have minimal side effects. I have a question here that refers, it says, my sister had PRP injections every month and had shock from injections, causing her hair to thin out. Have you seen this, and what percentage of people get hair shock from these injections? That's a good question. I've actually never seen that, and I've done, hundreds and hundreds of injections at this point for hair loss and thinning. I would have to look into that further. Hair shock is not even listed as a side effect, so I can get back to you specifically on that. But for what I've seen in office and from all the research that I've done with this treatment, I have not heard of that. And then the last question I'll take today, because I just want to be able to wrap up here. I've always had thin hair, even when I was much younger. After my pregnancies, it really thinned out. I'm now 59. Would this treatment bring me back to thick hair, or would it bring me back to my thicker hair prior to pregnancies? That's a really good question. Like I said, the results vary from person to person, but it definitely will thicken your hair. Especially, any hormonal, we see this a lot with hormonal imbalances post pregnancies, and the hair thinning out. And we have great regrowth and thickening post pregnancies or post menopause with doing the activator treatment. So I would say yes, you can definitely get thicker hair. Will it bring you back to your pre-pregnancy? That's hard to answer directly, but I would say out of everything that's available on the market, it's a really, really good option for you. All right. Hopefully I've been able to answer all your questions here. If I didn't, please feel free to email me, or give a call to the spa. I'm very happy to answer any additional questions, and the email would be yourSkinSpecialist@GreenwichMedicalSpa.com. Just going to close out of this. Also, please connect with us on YouTube as well as Instagram and Facebook for new updates and educational information. You can also subscribe to our monthly newsletters to get the latest updates and promotions. And like I was saying, speaking of promotions, we're offering our at-home activator package that includes the laser cap, your first bottle of Nutrafol tablets, and your first bottle of minoxidil on our website for those of you who want to get started regrowing and preventing hair thinning right from your own home. It's been such a pleasure to educate you on hair restoration and the activator treatment. At the end of the webinar, you will receive a brief survey that you can fill out, and hopefully we can improve these future presentations for you. Please join us next week for everything you need to know about vaginal rejuvenation. So again, that's next Wednesday at 12 p.m. Thank you so much for having me today, and I can't wait to see you all soon. Stay safe and healthy, and hope to hear from you all. Have a good day.